Hey everyone, welcome back to another video. In today's video, I'm going to talk about nurse practitioners in Canada and describe what nurse practitioners exactly do and give you an update on what the nursing scope of practice is for nurse practitioners. If you want to gain more information about nursing, please consider subscribing down below. I upload a video every single week. Also, please be sure to check out the description box down below where I have free resources such as a free NCLEX guide, a free fitness, and a free nutrition guide. I would also greatly appreciate it if you give this video a thumbs up. It would mean the world to me as it helps get this video out there for other people to see. So let's get on with today's video. Nurse practitioners in Canada are a great resource for many Canadians who require care from a provider. It is important to note that there are many types of providers of care. The most common today is a physician, but there are other disciplines such as nurse practitioners, physician assistant, and holistic nurse naturopathic physicians that can provide care. If we want to improve the general public's knowledge about different providers of care, such as physician assistants or nurse practitioners, it's important that we adopt proper terminology and we call the physicians that we know today as providers. This will better help the general public understand that, if a nurse practitioner comes in to assess them, diagnose, and treat them, they're getting quality care similar of that to a physician. It's just something that I think it's worth mentioning, and it's important for healthcare professionals such as nurses, and amongst all the other disciplines to adopt that type of terminology. So what is the scope of practice for a nurse practitioner? So nurse practitioners are essentially registered nurses who have additional education and nursing experience, which enables them to autonomously diagnose and treat illnesses, order and interpret diagnostic tests, blood work tests, any types of tests essentially, prescribe medications, and perform special medical procedures. Nurse practitioners generally focus on treating the whole person and includes approaches such as addressing the needs relating to a physical and mental health of a person, gathering medical histories, focusing on how an illness affects a person's life and their family's life, offering ways for a person to lead a healthier life, and teaching people how to manage chronic illnesses. That's essentially what they focus on, whereas I think for the most part, a physician focuses on a biomedical model. If they have an infection, we want to treat the infection with antibiotics. Well, and they need to be in the hospital for that. Well, what does the nurse practitioner think? Yes, they need antibiotics, but what does that mean for the person who might be indigenous and has a traumatic experience? How do they cope in the hospital setting? How can we provide them holistic care as well as the biomedical approach in order to provide better care for them? Not to say that one method is better than the other. I think both physicians and nurse practitioners are valuable in their fields, and they provide great care for patients. It's just a little bit of different in the emphasis the schooling provides compared to a medical doctor, where they focus on the biomedical. The nurse practitioner focuses more on a holistic approach and takes a look at all the different aspects in someone's life in order for them to get the best care possible. So now let's talk about the statistics for nurse practitioners and different facts that I found were interesting. Apparently there are 6,159 nurse practitioners, which is a growth of 8.1% from 2018, the largest increase of all nursing designations. In fact, nurse practitioners have had the highest growth rate of all nurses every year over the past 5 years from 2015 to 2019. Of course, this statistic doesn't take into consideration 2020, but in general, nurse practitioning is an up-and-coming field. So now let's talk about where nurse practitioners are employed. So 58% of all the nurse practitioners work in a hospital. 15% work in community health, another 15% work in a nursing home or long-term care, and 10% work in other employment settings. That could mean like telehealth, or that could mean they have their own business, whatever the case may be. So as you can see, nurse practitioning is an up and coming field, and it's slowly growing to a rate where they're becoming dominant in a mid-level provider field. This is important, and this is a huge breakthrough for patient care in hospital and in community settings, because it helps take the burden off all the physicians, and it allows for another provider to come in and take a workload off all the physicians in Canada. And this is important because, as many of us know, hospitals are constantly overrun with patients. Well, if you have better access to providers, that can prevent a lot of hospital admissions and hospital visits, and ultimately better the health of the general public and reduce costs of the healthcare field, which essentially is going to save taxpayers money. Lastly, I want to talk about different fields where nurse practitioners work. So, as many of you probably know, nurse practitioners can work in different subspecialties: emergency departments, long-term care, rural and remote communities, primary care settings, and inpatient settings such as cardiac, palliative, medicine, and even surgical sites. So nurse practitioners can specialize and work in various different settings as that mid-level provider, which can remove a lot of this burden, like I mentioned, on the physicians in general, and ultimately provide better care. Anyways, I hope you enjoyed this video. Let me know about your thoughts about nurse practitioners in general in the comments down below. I would love to hear your feedback. Obviously, being a nurse, an emergency nurse, I do have a little bit of bias, and I think nurse practitioning is absolutely the greatest field, and I think it's amazing for nurses to be able to specialize in it. However, I do respect physicians with their great amount of knowledge they know. That's not to say that, I'm not here making a video talking about how nurse practitioners are better than physicians or physician assistants for that matter. I just think nurse practitioners are helpful for an overburdened healthcare system, and they can be help to physicians because ultimately physicians in general have a better level of knowledge for, their subspecialties, because they essentially have gone to school for a decade. And so I think that, working together as a team, like it should be suggested in the media and in school and everything, working in a team can provide better care, and having a new discipline as a mid-level provider can provide better, appropriate care for many different patients, essentially providing patients with quality care and ultimately preventing them from coming to the hospital. Anyways, guys, we'll catch you in the next video.